Today let us discuss about type 4 hypersensitivity reaction. Type 4 hypersensitivity reaction, also known as cell-mediated type of hypersensitivity. It includes inflammation resulting from cytokines produced by the CD4 T cells and also cell killing by CD8 T cells. Now let us discuss in detail about this. Here is an antigen presenting cells presenting antigen to the CD4 T cells via the MHC molecules. When these antigen presenting cells present antigen to CD4 T cells via the MHC molecule, they can differentiate along different pathways: Th1, Th2, Th17, etc. It depends upon which is the cytokine produced by the antigen presenting cells. So when the antigen presenting cell present antigen to the CD4 T cells and secreting interleukin 4, they differentiate along the Th2 pathways, that is antibody mediated inflammation. They secrete Ig antibody. See, if the antigen presenting cell secretes interleukin 12 while presenting antigen to the CD4 T cells, they differentiate along the Th1 pathways. So the antigen presenting cells present antigen to the CD4 T cells and the antigen presenting cells secretes interleukin 12, so that they differentiate along the Th1 pathways. In Th1 pathways, these activated CD4 T cells secretes other cytokines such as interferon gamma, TNF, etc. These interferon gamma produced by the activated CD4 T cells can activate macrophages. These activated macrophages will have more cytoplasm, more phagocytic activity, and they are known as epithelioid histiocytes. Like the epithelial cells, they will have more cytoplasm, abundant cytoplasm. So interferon gamma activates macrophages so that they have abundant cytoplasm and they become epithelial-like with abundant cytoplasm and more phagocytic activity. And this collection of these activated macrophages or epithelioid histiocytes is known as granuloma. Now let us see a histological picture of a granuloma. These are lymphocytes. Lymphocytes have scant cytoplasm, and whatever we see is nucleus. This nucleus has a condensed chromatin, so it appears dark blue. Nucleus with condensed chromatin. Cytoplasm is indistinct because they have scant cytoplasm. So whatever we see is the nuclei. And here are the collections of epithelioid histiocytes. So when the antigen presenting cell present antigen to the CD4 T cells, they secrete interleukin 12 so that they differentiate along the Th1 pathway, and these activated CD4 T cells secretes interferon gamma. This interferon gamma activates macrophages, and these activated macrophages having abundant cytoplasm, more phagocytic activity, known as epithelioid histiocytes, and this collection of epithelioid histiocytes form the granuloma. This epithelioid histiocyte has this elongated nucleus, and nucleus is not as dark as here, not condensed chromatin as here. They are having fine chromatin. This elongated nucleus, and some are slipper shaped, elongated slipper shaped nucleus with fine chromatin, and they have abundant cytoplasm and indistinct cell border. We cannot say where one cell ends and one cell when another cell begins. So they have indistinct cell border, abundant cytoplasm, these elongated nucleus which are slipper shaped. So this collection of this epithelioid histiocyte form granuloma. Granuloma can be seen in multiple diseases, for example tuberculosis, sarcoidosis, fungal infection, borreliosis, etc. One difference is that in tuberculosis there can be caseation, central caseation necrosis, while in sarcoidosis it is non-caseating granuloma. Here is a tuberculosis granuloma because here there is central caseation. In sarcoidosis it will be non-caseating granuloma. So there is central caseation necrosis. Here are multiple epithelioid histiocyte forming collection, forming granuloma. And some of these epithelioid histiocytes may fuse to form multinucleated giant cells. These are known as Langerhans type giant cells, not Langerhans cells. Langerhans cells are antigen presenting cells in the skin. It is Langerhans type giant cells. Here is the abundant cytoplasm. Multiple epithelioid histiocytes fuse to form Langerhans type giant cells. These are the nuclei arranged at the periphery like a horseshoe pattern. So these are the Langerhans type giant cells. So epithelioid histiocytes, central caseation necrosis, abundant cytoplasm, and the nuclei are arranged in the periphery like a horseshoe pattern. These are Langerhans type giant cells. This is tuberculous granuloma. Then we will briefly discuss about CD8 mediated killing. CD8 T cells can kill by two ways. One is perforin granenzyme pathways. In perforin granenzyme pathway, perforate the cells. Through this perforation, they can release granenzyme into the cell. This granenzyme can activate caspase B, which can trigger apoptosis. About this, we will discuss detail in apoptosis. So, perforin granenzyme pathway, perforin perforates the cells, release granenzyme, which activates caspase B. Another is these activated cytotoxic T cells express FAS ligand. FAS ligand is a death ligand. So they can bind death receptor and activate extrinsic pathway of apoptosis. So two mechanisms. One is perforin, perforate the cells, release granenzyme, which activates caspase B and triggers apoptosis. Perforin granenzyme pathway. Another is these activated cytotoxic T cells express FAS ligand, which can bind FAS, the death receptor, and activate extrinsic pathway of apoptosis. Now let us see a question. A 40-year-old man has chronic cough with a fever for several months. Chest radiograph reveals diffuse reticulonodular pattern. Microscopically on transbronchial biopsy shows focal areas of inflammation containing epithelioid cell granuloma, Langerhans giant cells, and lymphocytes. These findings are typical for which of the following type of hypersensitivity immunological response. So this gentleman has chronic cough with a fever. Whenever there is chronic cough, we should think about tuberculosis. Chronic cough with evening rise of temperature, we should always think of tuberculosis. And biopsy shows collections of these epithelioid histiocytes forming granuloma. Collection of epithelioid histiocytes, granuloma, and some of them has fused to form Langerhans type giant cells and lymphocytes. So granuloma formation is there. So it's a type 4 hypersensitivity reaction. The answer is type 4 hypersensitivity reaction. Thank you.